So implicit with the idea of treating the pre-symptomatic patient is identifying these patients. And in the United States, there's a large effort devoted towards newborn screening so that these babies can be identified shortly after birth, confirmed that they in fact have SMA, identify what is their copy number, try to identify which patient does in fact need to be treated right away, and are there some patients where you could perhaps reasonably delay that a little bit. But you don't want to wait until they become symptomatic, because we've learned through multiple studies now that the earlier you treat, ideally in this pre-symptomatic phase, you get the optimal response to all these treatments. There was an interesting paper at the World Muscle Society meeting suggesting that, in fact, the pre-symptomatic babies may not, in fact, be pre-symptomatic. They looked at, this was the work of Linda Lowe's at the Nationwide Children's Hospital, and she has a very nice setup where she does a video capture of the baby's movements, their spontaneous movements. And she was able to compare a baby who has SMA, but looks pre-symptomatic, and compared the spontaneous movement patterns with that of a typically developing baby without SMA, and showed that there was a sizable difference in the movement patterns. So it may be that if you look more carefully, these babies are showing even some very early limitations in their motor function. And we may need to change that word pre-symptomatic to something better. But I think the take-home point is the same, that we really need to start thinking that there will be these two populations of patients. We'll have the symptomatic patients that we've identified in the clinic. We need to try to treat them as early as possible. Then also try to identify these pre-symptomatic patients largely through newborn screening. And that effort is also developing in Europe. So it's not just a US experience. I think all the health authorities and the physicians and academics who treat these babies realize that we need to start focusing our effort on newborn screening. So with that, I think you're going to see over the next couple years an increasing focus on that population.
And even with in a country with good medical care, the delay is quite substantial. It was between 2 to 3 months after the onset of the symptoms. I think the overall recommendation is, and this is same problem in the US also, that the diagnosis is delayed, and the way to really improve this, number one, educating or primary care providers, pediatricians, family practitioners, to recognize the symptoms of muscle weakness, hypertonia, delayed motor milestones, feeding difficulties. And instead of sending these patients to physical therapy, they would need to send the patients to a neurologist to give the diagnosis. But the other important thing is to introduce the neonatal screening, which is on the way in many states, including in my state, in Connecticut. The other important thing is to right away having treatment available after the neonatal screen that picks up the disease in a patient. Of course, another possibility is carrier screening before conception. In some states and OBGYN practices offer carrier screening.